Hi friends, this is Dr. Balakumari. Today we will talk about irregular periods. Before watching this video, I request you to watch my previous two videos about what is menstruation and what is normal menstruation. It will be easier for you to understand this video. Three women came to me some time ago with history of irregular periods. For one woman, I gave some prescription of tablets and sent her. The second woman, I told, you do diet and exercise, you will be fine. For the third person, I said, I'm sorry, we really cannot cure this, but we can give you some tablets to get bleeding every month. When the complaint is the same, why is there a difference in treatment? Let us see. Generally, periods come in 28 days cycle, but any time between 21 days to 42 days is fine. But if it is less frequent, say once in 60 days or once in 90 days, that is once in 2 months or 3 months, or if it is too frequent, like once in 15 days, both are abnormal. What are the problems due to irregular periods? The irregular periods, first and foremost, is an inconvenient one. You really cannot plan a trip or a holiday or go to a temple or any other special events. But that is only a small inconvenience. But the real problems are most of these women with irregular periods develop obesity, PCOS, diabetes, hypertension, and endometrial cancer later. Is it not important to treat it? For the normal menstruation to occur regularly, the woman has to ovulate every month. If she doesn't ovulate every month, she doesn't get her periods regularly. For this ovulation to occur, there is a coordinated events occurring between pituitary hormones like FSH, LH, and another two hormones called TSH and prolactin. These are hormones secreted by the pituitary. There are another group of hormones secreted by the ovary: estrogen, progesterone, and testosterone. Estrogen is a feminine hormone. Progesterone is a pregnancy hormone. Testosterone is actually a male hormone. Is there male hormone in a female body? Yes, there is a small amount. So actually, the raw material for these hormones, estrogen, progesterone, testosterone, is cholesterol, and that cholesterol comes from the fat in our body. Normally, only the ovaries secrete these hormones, but fat also secretes to some extent. We can call these hormones as a family of hormones. Let us call FSH the father of the family. The father comes down from the pituitary, develops follicles, that is his daughters. When she grows well, she secretes this hormone called estrogen, which goes and prepares the endometrium. And then once she is mature, the mother, LH, comes. She releases the egg. Then the ovaries produce progesterone, the pregnancy hormone, which is again to support pregnancy if the woman becomes pregnant. During this process, a little amount of testosterone is also produced. This testosterone is like her elder brother. Sometimes, when there is too much domination by this testosterone, again he doesn't let the follicles, that is his sister, grow. In this family, there are two more aunts. The first auntie is called the TSH, thyroid stimulating hormone. Her function is to take care of the thyroid problems. But if thyroid doesn't work, the TSH level increases, and that comes and disturbs the development of the follicles. There is another auntie, the younger one, called prolactin. Her job is to secrete milk when the woman delivers. Due to some reason, this prolactin also can increase. It will come and disturb the follicle development. So this is the first category of women who came to me. They came with a complaint, had a thyroid problem, gave them thyroid medications, they become alright. The second category of the woman who came to me, she is the obese woman who has lot of fat in her body, who are secreting more of testosterone and estrogen from the fatty tissue. The fat in our body is like the grandma who keeps supplying, who keeps spoiling the grandchildren. So she gives lots of cholesterol. The production of estrogen and testosterone goes very high, and then there is no ovulation. So I told them diet and exercise will help you. After diet and exercise, the cholesterol level came down, the hormone production became normal, and she started menstruating regularly. The third category, whom I said we really cannot treat, there are conditions called premature ovarian failure, where the ovaries stop functioning much earlier in life, say even around 30 35. In these situations, the hormones FSH and LH will be very elevated. So, actually, if the ovaries stop functioning, we really cannot treat them, but we can artificially give these estrogen progesterone hormone and can produce bleeding. So now you know that irregular periods has so many reasons and you have to treat them accordingly. But the commonest cause for irregular periods is obesity or overweight. A little reduction, even 3 to 5 kgs of weight by diet and exercise. Again, don't depend on medications. Diet and exercise will help you to regularize periods. And who has to do the diet and exercise? Obviously, you. So, do diet and exercise, keep the fat under control, and you will be able to regularize the periods. We'll see you in the next video. Thank you.